Hello, parents, and welcome to our virtual Pediatric Campfire chat, brought to you by Crystal Run Healthcare. As pediatricians and parents ourselves, we created this series to open a dialogue to provide education and answers on a variety of topics we know have been weighing on your minds throughout the COVID-19 pandemic. Your Crystal Run pediatrician is a trusted advisor during these difficult times. So sit back, get cozy, and get ready to chat. Well, good evening, everyone, and welcome back. We took a month off from this series of discussions, and we're happy to be back to talk to you again and hopefully to give some information on a really important topic. You know, this is a time of year that usually we're all thinking about going back to school as parents and as kids with sometimes some mixed emotions. But this year, going back to school has taken on a sort of a different tone in terms of how that will happen and how it will be safe and how it might be different. And so we wanted to kind of shift gears from our series over the summer and get everybody back today to talk about the process of going back to school and hopefully have a great discussion with two of my friends and colleagues and also to hear from you, the parents that are on. So thank you for joining us. Just as a reminder, this is live television, so we never know exactly what's going to happen. We are in a broadcast mode, but there is a chat function that you can submit questions. Some of you submitted questions before joining today, and so we'll be happy to answer those and to do that as we go along. But if you have a question as we're talking, feel free to submit that in our chat box. So before getting started, I just wanted to first introduce my two colleagues, and then we're going to get into the sort of the heart of the discussion. So first, wanted to welcome and Dr. David Hill, and Dr. Hill, I think you got to take yourself off mute so we can hear you. But Dr. Hill is one of our pediatricians in the Middletown location in our 100 building. And David, I was wondering if you could introduce yourself to our folks that are listening. Let them know, if you want, how long you've been a pediatrician, some interests that you have within pediatrics. And then also, as we kick this off, I always ask our physicians to share with families what they've been doing during the last few months of kind of sheltering at home and now coming out a little bit more frequently, what you've been doing to kind of keep yourself busy. So take it away, Dr. Hill.
Thank you. Good evening, everybody. Welcome to our Campfire chat. My name is David Hill. I've been in practice in Middletown for about 31, 32 years, which is kind of a drop in a bucket when I look at some of my other colleagues like Dr. Baker and some of the others that have been around longer. But I've seen a lot of changes in medicine during that time, and a lot of them are for the better, including are actually joining the Crystal Run healthcare team several years ago. My interests are general pediatrics, but I also take a big interest in treating children with focusing issues, both ADD and ADHD, as well as other children that have other special needs, such as children on the autistic spectrum. But I like seeing children for all kinds of different illnesses, and not that we want them to be sick, of course. And I like doing health maintenance treatments as well. During the pandemic, it's been rather challenging. In one way, I've been lucky in that I'm enrolled in an educational program outside of my practice. And so I recently completed a course on medical ethics, and I've been taking other classes as well to fill my time. So my time is pretty filled.
Great. All right. Well, welcome, Dave. We look forward to hearing more about kind of special needs and learning issues later on, and we're going to get to that topic as part of our discussion. So thanks and welcome. And next, we welcome back Dr. Remenar, who was with us back earlier in the summer. And Dr. Remenar, if you wouldn't mind also introducing yourself, and feel free to share what you've been up to since we last saw you and also during the last several months.
Sure. Again, I'm Lin-Lin Remenar, and it's hard to believe I've been in practice for 20 years now. I have brought you into my kids' virtual learning space, so I thought that I would kick this series off with you all seeing where they are going to be learning, as well as we'll talk about this, getting them excited. So I did buy a new dress for this talk here so that I can feel excited just as the kids go into the school year, getting ready for that. My particular interest in pediatrics is really getting kids excited about taking care of their health, as well as just being excited about learning. So I guess I love the preventative care of things. I certainly love kind of dissecting also things that may be challenging in helping kids with illness. But I think my passion is really teaching kids to love to learn, as well as to take care of themselves and be excited to continue that for the rest of their lives. In terms of what we've been doing, we've spent a lot of time at home, including redoing our backyard deck near our pool. And so we actually procured quite a bit of lumber initially before, during this COVID time, and we've kept it to the front of our house. And so we often get stopped and are asked if we're going to continue to use our lumber, because apparently there's been a shortage and everyone kind of has the same idea. So we've been working on that to just make our space more inviting and hanging out. And other than that, I've been catching up on a lot of reading. I just don't normally get as much chance to read as I really would like to. And true nature of wanting to read before I actually see the kind of video production of it, I just finished Little Fires Everywhere. So I'm looking forward to going to Hulu and looking at that series up next. So I've been engaging in a lot of things that I usually don't get a chance to do.
Great. Well, welcome to both of you. And again, thanks for joining. So I just wanted to spend the first couple of minutes just giving kind of a background of how we got to this place where we are now in terms of school almost upon us. And so I'll do that, and then I'm going to just outline what we plan to talk about today. There's a lot of information to talk about. One thing before getting started, I just wanted to let folks on the line know that we're not going to talk about teachers. We love teachers. I have 2 siblings that are teachers. We are certainly worried about teachers and know about the worry that many of them have. But that's sort of beyond the scope of our talking today. We're really going to talk about the sort of kids and what will happen to them, assuming that they're going back safely, and what they can be, what we can do to help them be safe. So just wanted to give that shout out to our teacher colleagues and let them know that we're thinking about them. So we're now 5 months plus since the first case of COVID in New York State on March 1st. And we've gone through a cycle of surge back in April and May, and somehow we've remained on the other side of that surge now for the last several months. And that's been through the hard work of a lot of you that are listening, and also through some of the measures that I think that have been put into place. But obviously we've all been watching nervously as cases have surged in other places around the country. About 3 weeks ago, our governor announced that schools could reopen with a few things that needed to happen in order for that to occur. And those were related to sort of percentages of tests that were positive as a marker of looking at disease activity. And so when that was announced, it was announced by Governor Cuomo that as long as the region had less than 5% positivity rate on testing, that schools could reopen. And schools could remain open as long as the positive test rate was below 9%. So essentially a gate to open and then a gate to close again. For the last 2 months, the positive testing rate in the Mid-Hudson region has been at 1%. And it has remained that way. There's been an occasional blips of activity, but we've remained at that low level now for quite a while. And so schools were given the option of, or were told to submit a plan for reopening. Those were submitted a few weeks back, and actually there was an extension made. At the end of this week, the Department of Health and the governor will be approving all of the plans submitted by the schools. In our area, I've heard of all of the different plans that have been submitted by schools, and we're going to get into that in a little bit today. But most schools are offering a plan of hybrid learning with a mixture of in-person and at-home learning. A few of the local districts, including Middletown and Minnesink, have announced that they won't be returning at all until the middle of October. And as part of those plans that schools have announced, they've also been communicating with parents their safety plan. So that's kind of where we're at. The date of starting school is almost upon us. And so one of the first things that we're going to talk about today, and I just wanted to kick it off with Dr. Remenar, was to share with families what measures schools have announced that they will be putting into place to try to create the safest environment that they can for, frankly, teachers and students as they return, and what can children expect as they return to school in person, what some of these measures might look like.
So I'd like to start off by saying that although we all are anxious about going back to school, that the low rate is reassuring, as well as what we're going to talk about in terms of having control of the spread of COVID. So the things that are in place that all schools are requiring are masks coming in to the schools. And this is a really important aspect of basically protecting the students. The masks themselves, there was a preliminary study that looked at close to 200 countries, and they found that just wearing masks decreased the death rate per capita weekly by 55% when they first announced the actually positivity of COVID, versus those that were active in wearing masks. So without wearing masks, it increased to 55% deathly rate per capita, versus wearing the mask and being aggressive was only 7%. So we know that the masks are really effective in helping to decrease the spread of the disease itself. I think David's going to go a little bit into detail about mask wearing. There is, not all masks are created equally, so we do have some references of how you can look at different masks. We do say through the World Health Organization that medical masks should be saved for essential workers and medical people and those that are deemed positive. Otherwise, probably in school, you're going to see a lot of cloth masks, and there are different cloth masks that will have effective rates in terms of decreasing transmission and spread of COVID. So one is the mask, and I know David's going to go a little bit into more detail. The other is the way COVID is spread, and the reason that masks are important is that it's spread either through respiratory droplets or it's aerosolized. So the ways that it's spread is either by cough or talking. So I think the measures that are put into place are, again, the masks that help, and also the social distancing. So again, most schools are saying that you have to be 6 feet apart in terms of in the classrooms themselves. And some classrooms are allowing for kids to take their masks off as long as they maintain that distance. So again, you want to be careful about maintaining that distance, as well as there are disinfecting in between students in terms of cleaning. So those recommendations are put into place. I think with the hybrid models as well as being online, obviously the hybrid models, most schools are having their population so that not the whole entire school is there, that can allow for the social distancing. So I think that covers most of the parameters. Was there something else you wanted to bring up?
So David, one of the questions that we got, and maybe David can just address this too, is about temp checks. So there was a question we received before the call about, why children weren't going to get their temperatures checked before they get on the bus. I just was wondering if you could maybe just speak about the clinical screening part, not just the distancing, but what can parents and children expect when they arrive at school in terms of allowing entry into the school?
So basically, it might be very, very complicated to have children have temperature checks as they're boarding the school bus. There's some children that don't take the bus to school. We're hoping that, and we know that we will get a lot of cooperation from our parents. So it would be important, if you don't have a thermometer, to go out and purchase one. It doesn't have to be an expensive thermometer. And we're hoping that you're going to monitor the temperature of your children before you send them. Maybe, even every morning I would take their temperature. and just monitor for other symptoms too. So make sure they're not coughing, they don't have a runny nose, they're not sneezing. It might be a little daunting to do those latter things because some of those could be allergy symptoms. So that's where we come in. You know, a call to us for advice would always be welcomed.
Right, and I think the other thing just to share about that is, you know, the governor's sort of requirements of schools are to actually do clinical screening in person upon arrival at school. So, you know, what we've seen and what I've noticed from the schools is that they will be actually checking temps and also asking questions about symptoms upon arrival to school. There was a question from one of the parents about, do we support 5 days in person? And I think, and I'll just comment on this, and then Lynn or David, feel free to jump in. The 5 days in person for all children to accommodate the distancing and the clinical screening. Imagine all of the kids arriving at school at the same time and having to have their temp checked and ask questions about symptoms. I think my view is that it's just not realistic that that can happen and maintain safety of the parameters that, at least the best information we have now, is the most likely way for the schools to stay open and be successful. I don't know, Lynn or David, if you guys have any additional comments on that part in terms of, you know, 5 days in person, and do we support that as an option?
I think it also depends on the size of the school. If the school is a private school and perhaps much smaller, and these building grounds are such where spacing could be maintained, then it might be feasible. But I think, like you said, John, it's going to be a very difficult thing to accomplish for most schools. And if they do offer something like that, they should also offer a hybrid system and just a system where you can stay home. I mean, they shouldn't mandate everybody to go to school for a 5-day system. I don't think that would be right.
Right, and I think all of the schools in the state are allowing families to totally opt out of in-person learning. And, you know, I think that may be an option for some families. We did get a question beforehand about a specific diagnosis in a child that has fatty liver, which is a medical condition. Lynn, can you just comment, what are some of the medical conditions that might cause a parent to, you know, consider whether or not they actually would like to send their child to school at all? You know, what are those that we know are high risk? And then what are some of the other conditions that, you know, maybe is worth talking about with pediatrician about, you know, precautions to take in terms of going back?
So sure, of course, this is an evolving question, but as far as the data that we know right now and with guidance from the CDC, I actually pulled out what the website itself is saying is concerning. So there are two categories. There are actually conditions where you're definitely at increased risk, and then there are conditions that you might be at increased risk. And the ones that you're definitely increased risk of having more complications from the COVID are cancer, chronic kidney disorder, immunocompromised state, obesity, and heart disease, sickle cell disease, and type 2 diabetes. Those are the parameters that they list that are definite increased risk. For those that don't know what immunocompromised means, that can involve people on a lot of times those that are on chemotherapy, who may have human immunodeficiency virus or other immunodeficiencies, or can be on medications that actually suppress their immune system, such as steroids or other biologic immunosuppressives. Those that are considered more might be at increased risk. So the data isn't necessarily there that says they're definitely at increased risk, which is interesting because asthma has been one of those. Since we see so many kids with asthma, so many children are so many families are interested in asthma as if that is a condition that obligates them to have to stay at home on remote. And it's actually on a might be increased. So asthma is a might be increased risk. Cystic fibrosis, interesting, which is a very chronic lung disease, is only on the might be increased. Liver disease, so we brought up the fatty liver disease. So, you know, it's an interesting entity because a child with fatty liver disease may have increased BMI, which if the BMI is too increased, obesity is one of those risk factors. But I think that data was shown more in adults than in children. And then type 1 diabetes, interesting, is in the might be versus the type 2 diabetes. So those are the lists that I saw on the CDC website. Again, we can't go over everything, but it's really nice if you click on each of those disease processes on the CDC website, they actually give actual reasonings for why those might be at risk. So, and we can provide it.
Just to share with parents, we are going to post some references and resources on our website after today, because there are a lot of things that we'd like to share with you for more information. If you go to our website, www.christopherandhealthcare.com/school, you can access some of the references that we'll talk about today. And then I just want to reemphasize too that, please reach out to your pediatrician. If we're your pediatrician, we'd love to talk to you about. I've had a few parents call me in the last week wondering about their child and their risk. We heard a lot about 2 months ago about the pediatric multi-inflammatory syndrome, multi-system inflammatory, PMIS, and we haven't heard as much about that. I think part of that is because we just haven't had as many cases locally. I don't know, Dr. Hill or Dr. Remenar, if you've heard anything recently about that, but I think as I've looked at the data, there really hasn't been an association with that condition with specific underlying diagnoses. And it has also been still quite rare, even though we heard about it back in May. I don't know if you guys have anything to add on that, and if you've heard anything new in terms of that disorder.
I think they're finding that it's, very widespread throughout the globe, but it's exceedingly rare. Even when we were seeing as many cases as we were seeing, compared to the whole population of New York State and all the pediatric population that had COVID-19, it's a very, very rare complication. And now that there's less COVID-19 around, it's not surprising that we're not seeing it, seeing it that much.
Yeah, and I think again, this is where this is such a complicated issue, because we are worried about kids, and I know a lot of people are also worried about kids bringing back illness to their family who are probably at higher risk based on the conditions that Dr. Remenar just mentioned. I mean, that's really what we've seen with the adults. And in the adult patients, it's obesity, diabetes, and high blood pressure and age, which we know are risk factors. So this is such a complicated issue in terms of, is it really the kids that are at risk or their families? But, thanks for both sharing on that issue. And again, the very, very, very large majority of children who have had COVID have done quite well. We got a few questions. I know, Dr. Hill, you wanted to show us a little bit about masks, but before you do that, maybe you could also comment on this. There are a few questions about, how long is it safe for my child to wear a mask? And also we've heard also sometimes from parents about kids with asthma and wearing masks. I wonder if you could just maybe share with families what you're recommending about getting kids used to wearing masks if for some reason they haven't.
Sure. So there are a number of things that you could do. One thing would be to try to desensitize children by having them wear their masks even when they don't need to, for maybe start out with a short period of time and then gradually increase the amount of time that they're wearing the mask within the home, just to get them used to the feeling of the fabric against their face, against their skin. That can be challenging for some children. Some children that have special needs are tactily defensive. They just don't like things around their face. So, that would be a good way to get them used to that, just starting out for a very brief period of time and then gradually increasing the time. The other thing that you can do is sort of make wearing a mask a game. So you could have them decorate a mask. You would probably have to clean the mask after you did that, but they could write their name on their mask if they're able to print their name. They could draw flowers or even put other decorations on their mask just to kind of make them a part of the process. You could also let them take care of their mask, make the mask their responsibility to keep. And doing things like that, might increase the compliance rate of the children.
Yeah, I've seen some really cool fabrics that people are making masks out of. I was introduced earlier this summer, and people on the call might be embarrassed for me that I didn't know what a lovey was. But Dr. Spoto was talking about kids who are coming in with their loveys, which I guess is a term used for stuffed animals by some families. And so loveys coming in with masks that they were wearing. I think there certainly are a lot of fun things that can be done. Are either of you aware of any dangers of wearing masks? I think that has been a concern, for some people with asthma or some families wondering about having their kids wear a mask. Anything that you want to share as far as any dangers with a mask on?
So just to follow up with what Dr. Hill was saying, a couple things too. We have some nice reference points on that's going to be on the website of how to introduce masks at different ages and how to progress and speak with kids about that. The other thing is I have not read any data or seen anything in terms of dangers of masks. In fact, I think, those kids with asthma, as we said, they might be at increased risk with complications of COVID. So in particular, I would think that it's safer for them to wear the mask to protect themselves. I do, and I've seen this every single day, we do have to be careful about the fact that just because kids are wearing a mask doesn't mean that they're secure and safe if they're not wearing them correctly. So kind of wearing them down underneath the nose and pulling them up and down, which I've seen in the office, is really a concern in that they might actually increase the risk, right? Because their hands are all over. So I've been really being conscientious seeing those kids and explaining that sanitize your hands, put your mask on, always take your mask off on the sides with your ears, not up and down, up and down, up and down. And so this is to Dr. Hill's point of practicing that at home so that kids are really comfortable and that becomes habitual and how they put it on in a sanitizing way and to keep themselves safe. I think that we are all initially we saw that, we would watch the presidential talks with Fauci, and my family and I would count how many times like people would touch their faces. It's just a habit that you don't really have a conscious knowing of it. I would be, on these Zoom conferences, putting in the little chat, I'm lovingly telling you, please don't touch your face, because, it's just, that's the safety measure. So I think the more, as Dr. Hill is saying, the more you practice at home, watching your kids, making them aware of those habits that they may not be aware of can help create a safer environment for that. So the other thing I would say is you could do something fun, like Dr. Hill was saying, even putting in, you have to have a kind of more carefree mom and dad, but putting sprinkles on the hands and then putting the mask on and realizing where exactly the hands are going with evidence of that. And the kid has a visual of exactly where the sprinkles are going. So.
Great. One thing I just wanted to circle back with that I thought was important to point out, and then we'll shift gears a little bit. I think we got a question about checking temps on the bus, and I think for this to be successful, if we're all committed to having our kids go back to school safely and schools to stay open, it is important for all of us as families to have sort of a social contract with our communities. And what that means is that it's no longer really okay to send our kids to school if they aren't feeling well. And also it's, it used to be sort of, almost like a badge of honor. I'm going to go to work or I'm going to go to school because I need to go and I'm going to tough it out even though I might have a cold, and really just need to move away from that. So I'm hoping that we don't have situations where kids are found to have a fever when they arrive at school, when maybe they already knew that at home. And then the other thing that's so amazing about sort of learning is that really if you don't feel your best, you can be home. And the schools that are doing remote learning are all offering an option for people to be at home every day. So our kids aren't going to miss out if they're not feeling their best. And also, I think we may not have any more snow days, because we now have a really good vehicle for allowing people to be at home and to continue to learn. So just wanted to remind our parents that it is almost a contract with each other. It is something for us to all be taking care of our community and watching out for symptoms. So that being said, what happens if a child is sick who has symptoms that might be COVID? What can parents expect in terms of what they need to have before they can go back to school, and how long they might have to be out of school. I'll kick that to either of you, Dr. Adhd or Remenar, who want to answer that one.
Well, it's the similar things that the CDC recommends for everybody. So you would have to have had 10 days elapse from the time of the original diagnosis. The second thing is you would have to not have had a fever for 3 days. And the third thing is that you would have to have been showing improvement in your other symptoms, your respiratory symptoms, for about 3 days.
Yeah, so those are for kids. So I think one of the things is that if you have symptoms, in order to return to school, you'll need a test. I think that's the new thing that, and then if you test positive, yep, that's exactly what you're saying, David, that it's 10 days from the time of symptom onset, and you have to be, actually they made a recent change to 24 hours symptom free. You don't need another test though. You don't have to test negative to go back after 10 days, but if you test positive, that is the case. Lynn, what about the kids that test negative? Like when can they be allowed to go back to school?
So with the symptoms of testing negative, the thought is that just to be safe, they have to have be symptom-free for at least the 24 hours of fever-free, and then cough and congestion at least 72 hours. So as long as the test is negative, I think we're treating it as if it's a normal cold. Of course, I want to remind families that if you decide to go to a hot spot state, that it really should be really a great vacation and be safe, because you will have to quarantine when you come back. And that's the case if during school you do go to one of those places, there will be a quarantine for 14 days to monitor for symptoms. And just to follow up, if there are symptoms at school, there are measures in place at school where the nurse will take the child out of the classroom and put them in an isolated area. The nurse will don what's called PPE or protective equipment for himself, and then call the parents to have the child leave as quickly as possible. And again, that child will need to be seen by a healthcare provider and get tested. And I guess the measures are then anyone who's exposed to that classroom will be, as long as that child is positive, will end up being notified. The families will be notified of that positive test in the classroom and exposure.
And then another thing that's, I think, really tricky and also important for families to be aware of is that if you have a household contact who tests positive, that your child also should be home for 14 days. Yep. So, you know, it's a weird thing. It always is confusing to talk about with families, but if you test positive, you can go back to school after 10 days. But if you have an exposure or travel to another state, as you pointed out, Dr. Remenar, it's 14 days at home monitoring for symptoms, because that's a period of time that you may still develop symptoms. We did get a question that I certainly have an opinion on, and I can answer, but I want to let you guys jump in first. The question is, why are we not requiring a negative test after someone tests positive? And I wonder if either of you want to take a stab at that, or then I'm happy.
I think all the current tests do is to test for the presence of the RNA or the genetic material of the virus. They don't tell us whether the virus is an infectious virus or a killed or dead virus or a weakened virus. And so testing positive at the end of 14 days really, to me, doesn't tell you much. It just tells you that you still have RNA in your nasopharynx, and that RNA might not be dangerous to anybody. A lot of the initial studies on COVID-19 and how long the virus was present on different substances like wood and paper and cardboard, a lot of those studies were done just looking at the RNA of the virus, and they didn't then see if the virus was able to grow in outside of the body in tissue culture cells. So all those kinds of studies really aren't helpful, and by analogy, the testing of somebody after the 14 days for the RNA of the virus, I don't think is helpful either.
Yeah, so they actually did a study. The CDC published this study, up to your point, David, where they tried to grow live virus in people that were infected after testing positive. And after 10 days, they are not able to grow live virus. So you're right, the PCR test that we all know tests for the presence of virus, but it doesn't test for whether the virus is alive. And there have been a lot of people that have had recurring positive tests over many months. But to grow an active culture, which is not the test that we do, the test isn't available. After 10 days, it really is not an issue. So that's where the 10 days comes from. The other thing is that testing supplies are still not adequate. And so to test everyone that has a positive test with another negative test would exhaust our testing supplies. And from a public health standpoint, it's really important that we're diagnosing folks accurately and have testing supplies to do that when they're sick, not for the follow-up. So I think those are some reasons why the policy is in place in that way. Okay. Well, that was a long talk about safety. And I want to make sure we cover two other important topics. So we're going to shift gears a little bit. And the next thing I just wanted to talk about as I touched my face, I apologize, was just talking about how families can be successful and help their kids be successful at distance learning. And then we're going to close up with talking about kids with special needs. So since Dr. Remenar is in her distance learning environment at home, I'll start with her. But Lynn, what are some of the things that for the time when there are some families that will be distance learning all the time, and there are some that will be rotating in and out? What are some things that parents can do to help their kids be successful learning in this sort of hybrid or new model as we move into the fall?
So I think just with anything in life, the idea of modeling as a parent. So, you know, your kids really feed off of your energy. And so I think that all of us are pretty bummed out about COVID. You know, it's taken a lot of our freedoms away, but in other ways, it's also allowed for us to actually focus on the things that are important in terms of family time and really having real conversations and doing things that we enjoy. So I think just the energy that you present to your children in terms of the online learning. So if you can have your kid be real excited. So, you know, if this is the environment my kids are going to be learning, I was thinking I need to go and get them new pencil holders and put this environment where they are actually, you know, do something cool for their environment. I know that, you know, like I said, buying a new dress for just this meeting that we're having here to project the idea that when you're doing something and it's the start of a new year and having kind of a new way of looking at it and being excited about it, I think will definitely help give a good attitude for the children. And it's nice, I think that letting kids know too that this is a different time than when it was in March. You know, the schools were really scrambling to try to get things together, but they've had time, and really looking at the details of a lot of these schools, they really are putting a lot of time and effort to make this a really good learning experience for the kids. And so bringing that to the kids and letting them know that. The other thing is, you know, really talking to your kids, kind of figuring out, you know, what their concerns are. I think you know, a lot of families have asked me in the office, you know, should I involve my kid in making the decision of whether they should be hybrid or online only? You know, I think ultimately as parents, we have to look at the whole picture, but you do want to get an idea of what's important to the kid. So, you know, if for instance, they say, you know, I'm really going to miss school because of gym, and you have to keep your child home because you have an elderly person who's very sick in your household, and so that's the choice you guys make, then if that's what's so important, maybe finding a way to make a gym day, or if you have other online families that you know are not at risk, creating a gym day that, you know, would be important to the child. So again, talking to your children and realizing what's important to them, and trying to get around that as well.
Yeah, that's great. I mean, raise your hand. We can't see you, but I'm guilty of this. Raise your hand if you have been critical of distance learning from the spring. And I think to Dr. Remenar's point, our kids hear that. And, I think having a great attitude about the change or having at least a positive attitude about the change is important for them. And I think that a really great piece of advice that I heard Lynn mention is don't forget to buy first day of school clothes, even if you're home. It is an exciting time. We all remember getting our new clothes to go back to school. We may not be able to shop in the same way, but still first day of school is still an important day for a lot of us. And, we encourage you to celebrate that with your kids. David, I wonder if you could comment on one of the things, and then I wanted to ask you about kids with attention deficit disorder. We spend so much time talking with kids and families about the sort of I don't know, danger is the right word, but the issue of screens and how much time we're on screens. And now we're doing something where kids are actually on screens much more often for school. Do you have some advice about kind of managing screen time, both in terms of going back to school and during the pandemic where there may not be as many things for us to do?
Yes, one of the things that falls by the wayside during, and this is more important for children with special needs, but it could be applied to everybody, is structure. And it's good anyway to limit the amount of screen time that your child has on the computer, but you want to balance that with the child's also the need of a child to unwind and relax. So it can be a fine line that you're walking, but because of the increased screen time on the computer, that children by necessity have to undergo when they're doing distance learning, they might need to cut back a little bit from their other screen time, whether it be television or working on an iPad or their cell phone or whatever.
Yeah, I think just to acknowledge that it's really hard because many of our parents are working from home now, and a screen sometimes, depending on the age of your child, provides something for them to do if you're not able to be with them. So it is really hard. I know we're struggling with it at my house. So I think just acknowledging the fact that screen management is difficult during this time, I think is important for all of us to sort of know and be aware of. So David, one of the things I was talking with you about the other day is a specific type of kids who we really worry about with screens because they tend to be very addictive for them is children with attention deficit disorder, which I know is a special interest of yours. What's been interesting for my patients, a lot of my patients with attention deficit disorder seem to do really well with the distance learning last spring. I had several families who came in and said, they had their best learning ever. And I'm not really sure why. I don't know if it's just their ability to focus on screens is better than on a person. But I'm just wondering, can you talk about attention deficit disorder during the pandemic and during distance learning? And what have you been suggesting to families about whether or not they should be taking their usual medication? And then also, how can we help kids with ADHD be successful if we're thinking about a time where they're going to continue to be dependent on screens for their learning?
So there are unique challenges in children that have either ADD or ADHD, or even other children that have other special needs, such as autism during the pandemic. A lot of these children have comorbid conditions, anxiety, depression, and those can also be made worse during the pandemic due to all of the isolation that we see, not being able to be with their friends, not being able to see relatives that they're close to. So that has to be kept in mind when you're treating these patients. But the most important thing I think for patients to have a good experience with distance learning, with screen learning, would be structure and constancy. So you would want to devote the same time. I mean, this will probably be enforced in the model where teachers will actually have live teaching and they'll be connected to the teacher in that way a certain time during the day. But if there's other times where there's free study time, on days where the teacher is not available, you would want to do that at the same time every day. You would want to do it in the same room of the house every day. Maybe not, I wouldn't do it in the child's bed. or even in his bedroom or her bedroom with all the distractions that might be around them. I would have the room quiet and comfortable for the child, just so they won't have many distractions bothering them and impeding them. And not just structure that learning, but structure other things in their life. They look for structure. That's what they have in school. And then they're in an environment at home where there's sometimes no structure or very little structure. So there should be structure in other things, like a set bedtime, a set meal time, and just the various aspects of their life. And like I said, this isn't just important for children with ADHD, but children that are on the spectrum also like constancy and structure.
Yeah, and so David, one last thing on this topic, and by the way, for those on the call, if you have questions, please feel free to submit them into the chat or the Q&A box on your screen. We're happy to take questions because I think our prepared stuff we're coming to the end of. David, I've worked with David now for I think 9 years or so since you guys joined with us, and obviously I've known you for longer than that. I did not know that your wife was a speech therapist, and so we were talking about, we received a question about this. For families who have children that are getting services at school like speech and OT, some of that has also gone to distance, which of course, I think is challenging. And so you were sharing with me a little bit about your wife's experience as a speech therapist that way. So I just wondering, can you share with families, how is speech therapy? What's her experience been as a therapist and being effective? And for families who do have those types of services as part of an IEP or an accommodation plan at school, what can they expect as we sort of move forward with this hybrid environment?
So parents that have children with special needs are the real heroes in pediatrics. These parents are really the advocates for their children. But sometimes their advocacy is done at distance while they're not with their children, while they're away from their children. So the only way that therapy works when it's done at a distance, when it's virtual therapy, is with the active involvement of the parent. So when my wife gives speech therapy, the parent is sitting right by the child and will sometimes be her hands if her mouth or jaw has to be in a certain position to produce a certain sound. And my wife does feeding therapy also, and she obviously won't be able to manipulate the child's mouth and hold a spoon a certain way for a child that has special needs, but she'll get the parent, she'll explain to the parent what to do. And the occupational therapists and physical therapists also utilize the parents for home therapy. I think some special needs situations will also be with a hybrid model. So, children will be able to go in some days and have live therapy, and on some days there'll probably be virtual therapy as well.
Okay, great. Yeah, and I agree with you that I think all parents are heroes, and in particular, your description of those with special needs, really tough time as well now for that. So, yeah. One thing that was just shared with me was that I think is important to know is that this year, probably more than ever, it's really important for parents to be aware of how their children are doing, progressing. The teachers may not have the same relationship in a distance model to know if mastery is happening. So it more than ever, I think as parents, we need to be touching base with teachers and with our kids about how the year is going. Don't let we shouldn't wait until the progress check 6 weeks into the school year if there's going to be an issue. So Dr. Remenar, we got a really hard question, so I'm going to throw it to you because this parent I know is also a hero just by the question, but this is where it becomes really hard. So the question is, what advice do you have for how we can balance two children, one who is a first grader needing a lot of help with distance learning, and then on top of that, a very active 4-year-old?
Oh, that is tough. I think as much as you can with the 4-year-old. So I'm sorry, the question is a 4-year-old that's very active, and then
a first grader who needs help with distance learning.
Okay. Wow. So I would not promote screen time all the time, but sometimes you just need a little bit of help in terms of, and all the screen time doesn't necessarily need to be bad screen time, right? There's actually educational screen time. So, maybe if the 4-year-old is willing to have learn time as the first grader is having learn time, mom can kind of petition a little bit on the side for that 4-year-old and give them kind of learning activities. I think with the 4-year-old, you're just going to have to keep it a little bit fresh. So again, having a little bit of screen time mixed with a little bit of paint time, mixed with a little bit of clay time, mixed with a little bit of, kind of just creative, allowing for that 4-year-old to have things to do to allow for the mom to focus on the first grader. I don't have a perfect answer, but I guess this would be my suggestions. Yeah.
Yeah, David, I don't know, David, anything to add to that?
No, I think Lynn covered it very well. You just have to tailor each child's experience to the age and developmental level of the child.
Yeah. And I think structure in that family is also important. If your first grader has a schedule, let your 4-year-old know that this is you're going to have your time with me at this time, and to even start the day that way, putting it up on a board, a calendar with colorful times and at least activities planned for the day. I think that can also help a 4-year-old who's active kind of get their kind of developmentally get their kind of head around what to expect that day. So yeah, no, that's a tough one. And for that parent that submitted the question, let us know how it's going. And again, for all of the parents on the call, we're definitely a resource for you. We know some of you individually. I recognize some names, but we're all happy to talk to you about specifics that are hard to necessarily talk about here. The last question that we got, which is one that was submitted beforehand, and so maybe I think the 3 of us on the call are at different stages of kids and things. But the question is, do you feel comfortable sending your kids to school? Or would you feel comfortable sending your kids to school? So I'll kick it off with Dr. Remenar, who I know has 3 kids still in school. And what do you think about how things are going?
So I'd like to start this off that although we are pediatricians, we are real people too, and we are struggling with this decision as well. So just to give you a little background, I have a senior in high school who is desperately wanting to go back. I have an upcoming sophomore, and then I have one going into 7th grade. And we collectively sat down as a family and asked them what they wanted to do. And they all said they wanted to go back as much as they can. So the hybrid model, which would be in our school district, was what they would like to attend to. Unfortunately, as all families have their own situation, my oldest son has a chronic kidney disorder, and we have diabetes in the family. And so we have chosen for our family situation right now is they're going to be remote for this first quarter, just for health reasons. And is the answer perfect? I don't think so. It upsets me that, my senior who just got his license, who's really excited to go back to school, is not able to do that. But I guess in the big picture of things, we can't risk him getting sick. So that's our choice for now. So I'm going to make a really cool online environment for him, whatever he wants. The other thing I want to bring up, this is a little bit off record, but when we were talking about routines, I just want to remind families as much as you can, diet really matters for kids. So just keeping good snacks at home, because if they tend to be home all day long, you want to make sure they're having nutritious foods in diet as well. So that was just my little plug for that. But yes, for now, my kids are staying home for this first quarter.
David, I know you don't have any kids in school still, but what are your thoughts about, how would you feel in terms of if you had a child still in school going back?
I think I would favor the hybrid model. Every family situation is different. So assuming my son doesn't have any major health problems, and so if he was of school age, and I think he would want to go back, maybe not full time, 5 days a week, but I think the hybrid model would work out, because when they thin out the population that way, you're going to be able to distance yourself, and the teachers and other officials in the school can be aware of what's going on. If people are not distancing, if there's too many people to control, it just won't work.
Yeah. Yeah, and so I have a rising 10th grader and a rising senior, and they're going back. I think for us and for me, one of the things that I like about whatever you think about what's happened at the state level and with the state government, the process of setting goals for the community and defining risk by disease prevalence, I think is a really good way of thinking about this. And the way that I view it is that I'm depending on all of the other families in my town for my kids to be going back to school successfully. And I also am depending on all of the other communities in our town for us to not get to the point that we have a 9% positivity rate again, which is where we were back in April. And whether or not people are, believing in masks or not, or, being careful about distancing or gathering, those are the things that will help us be successful. So I'm comfortable going back. I trust and believe in my community. I'm comfortable with my kids going back. There was a question earlier as to whether or not we think this is going to work. And I think that it depends on all of us. And I hope it does. I think we're well positioned to be successful in the Mid-Hudson region with where the current disease state is. But in order for us to successfully stay in school, and I'm not as worried about necessarily, and fortunately, we don't have a health situation, and I would make the same decision that Dr. Remenar is with that circumstance. But I think it's more, I know my kids want to go back. They need the social interaction. But this is only going to work if we all help and support each other. And that means helping and supporting people that we don't know. And that means keeping our kids home if they're not feeling their best. And it does mean wearing masks, and it does mean being careful about gathering. And I think if we can do that as a community, we can be successful here, but it really depends on everybody working together as we move into the fall. So, all right, well, that's my last comment on that. So I think we're going to wrap up. This has been a really interesting conversation. There's so much here. We could talk for another hour. We haven't even scratched the surface on some of the details. And again, I just wanted to remind parents that, your Crystal Wren pediatrician or your Crystal Wren family physician, or even if you're looking for advice for yourself, please reach out to us. We've been talking with families and patients about this issue now for quite a while, and we're happy to be an additional resource for you. Please go to our website. We're going to post some of the references that we had. There's some great references around how families can support kids who are distance learning that we talked about here a little bit today as well. Again, www.crystalrunhealthcare.com/school. So we're going to close as we usually do. We'll start with Dr. Hill. So David, what advice do you have for families as we move into the fall for them to maintain resilience as both a family and for their kids, and to maintain their kind of mental health and physical health, and to sort of keep moving forward during a challenging time?
I would say to do things together more. So have meals together, go outside on walks together, just be with each other more. I think we've learned the value of family during the pandemic, and I think it's continued to utilize that. The other thing is that we should have hope that there is going to be an end to this someday. There is a final end point. Hopefully they're going to come up with a good treatment drug or drugs, and hopefully there's going to be some vaccines available in the foreseeable future. And I also wanted to mention, like you did, John, that you are more than welcome to use us as your resources. If you have any questions or concerns, during the crisis, we're always here for you.
Great. No, thank you, David. I agree, and I echo those sentiments. Lynn, how about for yourself? I know we heard from you back last month, whenever that was, about resilience, but talk to us about resilience moving into the fall.
So again, I think last time I had mentioned that I think the best way to get through this is remembering and being having gratitude for the things that have gone well. So although I had mentioned my son has a chronic kidney disorder, he has had some flares, but he has remained well. He has not had COVID and has gotten through that fine. We've had extra time together with the family. I've had the privilege of reassuring and taking care of my patients throughout this time period safely, and that gives me a chance to really, as David was saying, seeing the light at the end of the tunnel, helping to understand as much as we can and guide our patients and our families through this. And so coming through this with gratitude really has helped me to stay on top of things and just really keep things in perspective. You know, there are a lot of families that unfortunately their family members or friends have succumbed to this disease, or that financially are struggling. And so again, we are here to help take care of the kids, but coming through this with gratitude is the best way that I can do this. I would also like to mention that I did not mention this, and I thought that I really should, is that there is going to be a lot of crossover with different illnesses. And so I do ask that families come in for the flu vaccine, because that will help to mitigate the amount of febrile illness. And we really don't want to forget that flu is still a serious disease itself. So as much as we can prevent kids from getting the flu.
Yeah, great point. So starting September 1st, the CDC recommended waiting till September 1st. And so we'll start doing vaccines in the practice then. If you are a Chris Run patient, you can call and or you can next MD us if you're on our portal, and schedule yourself for a flu clinic appointment. Or if you're coming in for a visit, we'll be happy to give you a flu shot at that time too. So yeah, great point, Lynn. Thank you for mentioning that. So I think you know, we'll sign off. I would just like to add, in terms of resilience, two things. One, be kind. There seems to be just a sentiment of people that are just really, I think all of us are feeling exhausted and tired, and sometimes that manifests itself as anger and irritability. And it's hard not to feel that way. I do hope we rally together as a community and as a state and as a country in terms of kindness and safety, as I think that is going to be, until we have a vaccine or treatment, our main path forward. And then the second thing I just want to encourage everyone is to just acknowledge to yourself that this is really hard, unprecedented. No one has ever lived through this type of situation: financial stress, physical stress, health stress. And it's okay to acknowledge to you and to your kids that we're all going through a hard time, and to celebrate each other for doing that up until now, you know, successfully. So I also lastly wanted to thank Dr. Hill, whose idea it was to start these series back in June, I think, when we kicked this off. And so it was great to have him on for our last one. And we might be back at some point in the future, depending on what happens. But and thank you for the parents and patients of ours who joined today, and also to our marketing team who behind the scenes helped put all this together. So with that, we'll sign off. Hope everyone is staying healthy, enjoying the last part of summer. And if you're coming in for an appointment, we'd love to see your first day of school pictures. So if you happen to be my patient, bring that in. Love to see that and to celebrate our kids as they get ready for school again. So thanks, everybody, and have a great night.
Good night.
Good night.